Hello, my name is Frederic Lohr. I'm the Global Operations Manager of Mission Rabies, and welcome to the webinar on Global Dog Rabies Control and how to get involved in these projects. Okay, let's dive right into this. So I'm quickly going to explain to you how Mission Rabies works, where we work, and what you can do to help. First of all, Mission Rabies works within the One Health framework, and the American Veterinary Medical Association defines One Health as the integrative effort of multiple disciplines working locally, nationally, and globally to attain optimal health for people, animals, and the environment. And this is really what Mission Rabies is about. So on the one hand, you have the dogs who have the rabies virus, who bite people, get infected by it, and then also in certain countries you have those free-roaming dogs who live off trash off the street. So the environmental component really comes into play here as well. And this is really what Mission Rabies is about, bringing all of these three areas together for a holistic approach to eliminate this disease. But first of all, just a quick refresher, what is rabies? Most of you will know, you've covered it in vet school or you've heard stories about it. But rabies is a deadly virus. It's probably the most fatal virus that is out there, and it can affect any mammal. So it most often spreads between dogs, raccoons, skunks, monkeys, but also in bats. And the rabies virus is present in the saliva of the affected animals. So when a dog, for instance, bites a person, the virus then enters the wound and attaches to the nerve ending. Infection can also occur if the saliva enters the body through any other sort of mucous membrane or broken skin. So you have to be really, really careful. For instance, if a free-roaming dog licks your hand and you have like broken skin on your hand. And the virus itself is actually quite fascinating because it attaches to the nerve ending and then slowly travels up to the central nervous system. So as you can see here, the dog bites a person. The virus attaches, slowly travels up there until it reaches the brain, where it then eventually causes a fatal encephalitis. There are basically two forms of the virus, how the virus presents that you have to differentiate between, which is the furious and the dumb form. The dumb form, also called paralytic form, and the furious form is really what most of you probably imagine when they think of rabies. It's those overly aggressive dogs. And as you can see in the symptoms list here, so aggression, confusion, but also just a change of the voice, of the barking. This is really quite striking when you see a rabid dog. And then unfortunately, within 1 or 2 weeks, death is inevitable. The majority of people affected by rabies are from low-income countries, unfortunately, and 30 to 60% of the victims are actually under the age of 16. So it's really striking. It's usually the kids that play with the dogs on the streets, that take care of the dogs, and they are the most vulnerable. PEP, post-exposure prophylaxis access, is variable in many parts of the world and often prohibitively expensive. So as you can see here, it's 31 days of age of the average Asian wage and 51 days of the average African wage. So rabies still has a massive economic impact with an estimated $8.6 billion every year. And unfortunately, this is just the tip of the iceberg. Those are only estimates because in many countries where rabies is endemic, the disease is not notifiable, and oftentimes there is no organized in-country surveillance system, and unfortunately also very little investment in rabies control programs. So just a little bit of our history as well, where we come from. Our CEO, Luke Gamble, founded the Worldwide Veterinary Service in 2003, which provides veterinary training and also runs animal welfare and population control projects and provides community education. So some of you might know the IVSA international training centers that we have in Ooty in India, in Goa in India, and also in Chiang Mai in Thailand. And really coming from this work, rabies was the obvious next choice. So in 2012, Mission Rabies was established as a project of WVS, and it rapidly grew after an initial very successful 60,000 dog mass vaccination drive all over India in 2015, and finally Mission Rabies became its own charity. But we're really still working closely together, and it's the same office, it's the same people, but just two organizations working hand in hand to tackle this disease with a holistic approach. How do we do it? It's It's very simple at first, it seems. We do dog vaccination. Obviously, the dogs are the reservoir. Over 99% of all human cases come from dog bites. So Mission Rabies is really focused on mass dog vaccination, but also not to forget about rabies education. If you remember earlier, I described that a lot of human rabies cases are actually children under the age of 16. So we're really focusing on primary school education and also community awareness. So to make those communities at risk aware of how to prevent rabies and also what to do if they get bitten. So just like washing the wound with sodium iodine for 15 minutes can already significantly reduce the virus load and can therefore make the difference between life and death. And as a third pillar, Mission Rabies specifically focus on is also rabies surveillance, actually getting that baseline data, showing that rabies is a problem, also that the intervention and actually has an effect. The surveillance system also helps saving lives by enabling people to report potentially rabid dogs, which can then be safely removed from the community, observed, and then also tested. WVS also adds another component to this, which is the dog population control. So as you can see, together we really form this holistic approach. As with everything, also in the world of rabies control, collaboration really is key. And as you can see here, we work with a plethora of organizations and governments to actually make this happen. Also, we have been working with IVSA right since the start. We've established a partnership in 2015, and we offer special conditions to come out to our volunteer trip to Malawi for IVSA students, and we're in close collaboration with the Standing Committee on One Health, which also brought you this webinar. So currently Mission Rabies is working pretty much all over Africa and Asia. We have our two flagship projects, our biggest projects, which are in Goa in India and in southern Malawi, but then we also have smaller projects in Ghana, Uganda, Tanzania, Sri Lanka, and also at our training center in Tamil Nadu, and also in northern India in Ranchi in Jharkhand state. So a hallmark of what Mission Rabies is doing was the development of our app, the Mission Rabies and the WVS app, and that really revolutionized the way we can direct teams and we can collect data in the field. Because all rabies projects around the world always face similar problems. You have to cover a large area, there are often no local boundaries. You have to control and direct multiple teams at the same time who might be traveling door to door depending on the project side, and often are living and working remotely. So we asked ourselves the questions, how do we do this in a comprehensive and efficient way so that no areas are missed and we don't unnecessarily duplicate our work, which was just a waste of time and money. So through the Mission Rabies app and through the WVS app, we're actually able to direct the teams. As you can see, the manager can sit at their computer, they can draft areas and then send those to the teams and their handsets, who can then actually act on that direction in the field. The app also helps with monitoring and evaluation, because you gather a lot of data from the remote areas. You can rapidly report on the different state levels, so whether district, state, or country level. And oftentimes in those areas you have a limited capacity resource for analysis. So with the help of the app, we can speed all of this up. So as you can see, the teams were sent out in the field, as you saw on the previous slide. The data comes in, they vaccinate the dog, they collect all the information about the vaccinated dog. The data flows back to the manager, which can then inform the manager's decisions, and the manager can then send the teams to the areas where they're needed. So if they have to go back because they haven't reached a 70% vaccination coverage, which is what we're aiming for, or if they can move on to the next area. As you can see, just as an example, in our project area in southern Malawi, it's a relatively large area, and what we do, we just break this down into workable chunks, and the teams can then go and vaccinate those areas. And as you can see, that in the light pink in the lower half, that is Blantyre city, which is a city of about 1 million people live in there. And you can see those areas are really workable chunks depending on the population size, so that teams can really achieve these areas in a day, really. And then back to the monitoring and evaluation as well. So as you can see here, this is a picture, a map of Ranchi in India, and all the dots you can see on the left side, those are vaccinated dogs. So we can really project all of our work on a map, and then also ensure, as you can see on the right side, that we hit the correct vaccination coverage. Most importantly for you guys is also, how can you get involved with this? Most of our projects are actually volunteer projects, so we really need help from international volunteers to do this. As you can see, it's a colossal effort to do this. And you don't even have to be a vet or vet student or vet nurse to come on board. That's the cool thing about Mission Rabies. You can, even as a non-vet, so if you have a friend or a partner who wants to come with you, that's no problem at all. There's so many roles that you can take on and get involved and really make a difference out there, work with our local staff at these projects, and make rabies history, really. In 2019, we'd be looking at Tanzania in January, which is already unfortunately completely booked out, but we still have some spots in February in Burundi, in Ghana. We'll be back in Uganda in July. We'll go to Sri Lanka again in September, and then in October, November, our Goa mass vaccination drive as well. So if you go to missionrabies.com/volunteer, you can find more information. You can sign up to our newsletter as well, where we announce new projects, and just get involved. Just come on board. So just to give you a little bit of perspective of what we've achieved so far, this was really just a quick run through, but since we started in 2013, we've vaccinated over 870,000 dogs and educated over 2 million children. So this is a colossal effort, and we'd really love you to have you with us. So if you have any questions, always feel free to email us, inquiries@missionrabies.com. Go on our website, reach out to your local IVSA chapter who can get you in touch with us as well. And I'm looking forward to see you out there in the field. Thank you very much.